This lecture will look at the drugs used in the treatment of peptic ulcer disease. So as usual, let's start with a patient, a 43-year-old female who presents with epigastric pain and vomiting. She recently had an upper GI endoscopy which confirmed peptic ulcer disease, and her biopsy was positive for Helicobacter pylori. Pause the video and let's see if we can work out what drugs she might be on and what drugs you may use in treating her. And again, see if you can think about the pharmacology of each of these drugs. So with peptic ulcer disease, the drugs that we often come across are proton pump inhibitors such as omeprazole, pantoprazole or esomeprazole, H2 antagonists, ranitidine and cimetidine, antacids such as aluminium hydroxide, calcium carbonate and magnesium hydroxide, antibiotics including amoxicillin, clarithromycin, tetracycline and metronidazole, and other drugs including bismuth, misoprostol and sucralfate. So we're going to go through each of these drugs and look at their pharmacology in a bit more detail. So the proton pump inhibitors inhibit the gastric hydrogen potassium ATPase pump through covalent, which is irreversible binding. And these are some examples. So they tend to be used as a first-line anti-secretory drug in peptic ulcer disease and can also be used for gastroesophageal reflux. These are some of the side effects. Probably the most important with long-term use is the suppression of gastric acid secretion can lead to changes in the gut flora, causing diarrhea, malabsorption, and particularly in older patients, the risk of pseudomembranous colitis. They also inhibit P450 enzymes, particularly omeprazole, and therefore can interact with other drugs that are metabolized by this enzyme system, such as warfarin. The antihistamines block H2 receptors, and the action of gastrin via histamine to produce gastric acid. They are used for symptom relief and as an anti-secretory in peptic ulcer disease and for gastroesophageal reflux disease for symptom relief. Particularly cimetidine has a fairly long list of adverse effects, including confusion and delirium, inhibition of the P450 enzyme system, and hormonal alterations which can lead to gynecomastia and galactorrhea. Antacids are generally insoluble basic compounds of aluminium and calcium which act locally on the stomach surface to block the effects of acids. And here are a list of some of the more common antacids, most of which can be bought over the counter. They actually can provide fairly fast symptomatic relief of pain due to peptic ulcer disease, gastroesophageal reflux, and acute gastritis. And although they're a fairly old-fashioned group of drugs, this can be very useful in patients who present with acute pain. They actually probably act faster than some of the other drugs such as the PPIs or H2 inhibitors. The adverse effects depends a little bit on which compound we're talking about. So aluminium salts cause constipation, whereas magnesium salts can cause diarrhea. Chronic overuse of calcium salts can lead to the milk alkaline syndrome. With soluble antacids, there's a risk of rebound hypersecretion because when you change the pH of the stomach contents, the reflex of the body is to produce more acid. Here are some other medications that we need to know a little bit about. Misoprostol, a PGE1 analog, which reduces acid production. Sucralfate, which forms a physical mucosal barrier to acid irritation. And bismuth, which is bactericidal and prevents the binding of H. pylori to the epithelial layer of the stomach and duodenum. If you have any questions, you can post them in class. So this lecture looked at the drugs used for peptic ulcer disease. We didn't speak much about the antibiotics because we would have covered those in other lectures. However, you need to know a little bit about which ones can be used for treating H. pylori, and also which drug combination regimes are used for the treatment of H. pylori. Thank you.